Okay, so I didn't put in these presentations sort of a summary of the symptoms. It was sort of operating with the idea that we had a shared understanding of the symptoms of, well, the symptoms within these disorders and how to diagnose these disorders. So, so talking about kids who have OCD, some discussion earlier today. This is referring really to kids who have, obsessions and compulsions, not kids who have autism, who have some repetitive, stereotyped, compulsive behaviors that get confused sometimes with OCD. So assuming that children have OCD, treatments that really, in terms of what's new in terms of this in the last 2 years, what's been published about as far as treatment for OCD, really most of what's been published is really about the psychosocial treatments, the psychological treatment. There's lots of studies, or there are some studies published talking about the intensity of the exposures, how intense those exposures need to be, how long those exposures need to be, how much to involve parents in the exposures, how much to involve, to target, family functioning, figuring out adherence for exposures, some use of internet-based treatments, things like that. So that's really where what's been being looked at is it's not so much in the medication realm. What I could find in the last 2 years since we last discussed this was that there was, in JCAP last year, there was a 1-year outcome for CBT treatment responders for pediatric OCD, that kids did maintain their response. So there's something about maintenance of efficacy of treatment, so showing that CBT was effective for over a year. And there was a study looking at aripiprazole augmentation for treatment refractory OCD, with a small study showing that aripiprazole augmentation was effective. So really no new, not really anything new in that regard. In adults, people are looking at medications that alter glutamate, and some in kids as well. So things that alter glutamate can affect compulsive behaviors by affecting frontostriatal pathways. So those are substances such as N-acetylcysteine, D-cycloserine, memantine, minocycline, modafinil, and riluzole. Those are the ones that people are mostly looking at and studying. So there wasn't anything that were positive studies. There were 2 negative studies in the last 2 years. There was a negative study of augmentation of cognitive behavioral therapy with D-cycloserine for kids. So it looked like that was positive in adults, but it was negative in kids. And similarly, when they added N-acetylcysteine to treatment refractory OCD as an augmentation strategy to cognitive behavioral therapy for kids with OCD, again, that was negative. Even though they've got nice studies with N-acetylcysteine in adults, it doesn't seem to be working for kids. So some of this question is, you get a lot of growth in terms of your dopaminergic neurons and that kind of dopamine system in the brain after puberty, and that that when you have child studies, that those things, they just may not have the kind of neural substrate that is going to respond to the same kinds of glutamate modulators that adults have. So maybe people will separate those out, kids and adolescents, or be looking at what age that happens. So that's really all that I saw related to medications and treatments for OCD. There was a few studies published looking at a kind of subset of OCD patients, the PANDAS patients. There was a randomized controlled trial for azithromycin for acute presentations of PANDAS. And there's some sort of retrospective case series looking at use of NSAIDs or oral corticosteroids for acute onset of PANDAS presentations or acute flare-ups. So that's just telling you that those are things I found in a literature search. I don't think we're going to be commenting about PANDAS treatment in this guideline. So that's really what I found as far as new studies as far as treatments for OCD. So in essence, that means, because there's very new information, there's going to be very little changes that I would recommend to the current guidelines. But we can look at whether we still think that these guidelines make sense, which they did to me. So we don't really comment at all on kids under the age of 6 for OCD treatment. At least I don't have it here. Is it in the guideline? I don't think that it is, right? No. I don't think so. So I don't know I don't know exactly if there's a reason we didn't comment on it. I don't know that we really have to go ahead and comment. You do occasionally see a young kid with OCD. You do sometimes see a 4 or 5-year-old. 6 probably captures it. I don't think we need to have a whole separate section unless.
Are you suggesting maybe a footnote or a comment at the end? Or?
I don't think we need to. I think it's not that many kids.
Okay. But thank you very much, Dr.
Thank you
Starr.
so much.